Hi everyone, I'm Dr. Rajat Kandhari, consultant dermatologist from New Delhi, Dr. Kandhari Skin and Dental Clinic. So I'm going to run through a scenario which may sound familiar to many of us. So my patient comes into the clinic and, "Hi doc, I just got back from Goa. I'm 2 shades darker than when I went there." I say, "Did you use your sunscreen?" "Of course I used my sunscreen, but this sunscreen's no good. I applied it, but it didn't do anything for me." "Okay, so can we just do a procedure very fast so that my tanning goes away?" Sounds familiar? Well, it's familiar for me. I'm going to discuss a bit about skin tanning today. So skin tanning has two components. One is irreversible tanning and one is reversible tanning. Now, when we talk about irreversible tanning, imagine a farmer out in the sun going to his job every day after day. There's trigger of the UV radiation on him and he tans further the trigger of the UV radiation, so the tan becomes irreversible. That means now his cells are used to this and they cannot recover very easily. Other than the tan itself, the UV radiation can have many more detrimental effects as well. The other tan is a reversible tan, which is when we go for a vacation to the outdoors, say to a beach, say to the mountains, or your son goes out and plays in the sun for day after day on his summer vacation. This causes something called as reversible tanning, which happened for a few weeks, but your body got the shock of the UV radiation, but it has now time to recover, right? What should you do to prevent this? Number one, use a good sunscreen. By a good sunscreen, I mean all sunscreens, many sunscreens are good, and we say they aren't because we don't apply them adequately and we don't reapply them. So when you're going out to a beach particularly and you're going to go into the water, your sunscreen is going to go off. So use an SPF 30 plus sunscreen. Use a sunscreen which offers you UVA protection. This is important and it's mentioned on your label. And particularly if you're going to be sweating and going into the water, reapply your sunscreen. Why reapply? Because it's going to form a uniform layer on your skin. So reapplication will help to give you better coverage. Secondly, you can use oral photo protection. That means oral sunscreens. You can use these maybe an hour before going into the sun, and these may help. The common ones are carotene, beta carotene, and also what we call polypodium leukotomus, 408 to 1200 milligrams per day. These can help to some extent. More than these things, what is important is your photo protection per se. Use a good hat, use your shades, if you are prone to sun-induced damage, try to wear full sleeves. I know it's not ideal when you're going to the beach, but it'll help. Mind you, every fabric also has an SPF. So if you're wearing linen versus cotton, the linen will let more sun rays penetrate versus cotton. Cotton has a higher SPF value versus the linen. So try and wear those kind of fabrics, darker shades if possible. Use an umbrella if possible. Fourthly, now when you come back from your vacation, try to stay indoors and let the tan sort of move off. Even if you stay home and relax, your tan will go off with time. But however, if you're really bothered by it, see your dermatologist or see a doctor. Now, what you can do when you see the doctor is, of course, first is medical treatment. Now, enhance your diet with carotenoid-rich foods, kale, spinach, bell peppers, carrots. And also hydroquinone can be used topically, azelaic acid, alpha and beta hydroxy acids, kojic acid, so on and so forth. Now these help and they will tell your tan to go off with a little due time, right? Secondly, if you must jump into a procedure, first and foremost, if you're coming back from your vacation, don't jump into any procedure straight away. This will only make your tan worse, particularly being a race which is darker skinned. If you're going to go in for a procedure, it will only enhance the darkness. So don't jump into it. Wait out 2 to 4 weeks before even considering any heat-based procedure. If at all you want to go in for a procedure, the procedures which can help are chemical peels, microdermabrasion, hydrofacials to some extent, and of course something called a mild laser toning or an IPL treatment. All these can help to quieten down your pigment cell and tell it to slowly remove the tan. Lastly, even if you don't do any of this, but you stay at home for a few months, your tan will go off. So just relax. So I hope this answers some of your queries related to skin tanning, how it occurs and how you can treat it. See your dermatologist if you're suffering from this. Thank you.